Hello, my name is Jebin Yoon. I will introduce of this paper. The paper name is the Interoception of Breathing and its relationship with anxiety. First, I will introduce the concept of interoception briefly. Literally, that is interoception is the meaning of the perception of our body and inner physiological condition for maintaining bodily homeostasis. Currently, there is some possibility that there is some possibility to play a wider role within the systems governing emotion, social cognition, and decision making. Then, if there is some impair or misconnection, it can induce the anxiety. Even there is some possibility to study many subjects, there were some limitations. For example, there are three main problems to study interoception. First, the bodily signals are both noisy and difficult to safely manipulate. Second, especially respiratory changes are highly silent. Third, aversive breathing is prevalent in psychiatric illness such as anxiety and panic disorder. Then, if we induce the aversive breathing without fine manipulation, we can emerge in anxiety state in participant. In recent years, a researcher has begun to consider different sensory channels and cognitive layers of interoceptive processing together. In this case, the cognitive layer refers to the lower level, which is just a simple signal strength, to the higher level, which is responsible for psychiatric cognition. The author expects that combination can be related with learning, but this topic is not studied well and no realistic synthetic data, even there are so many theoretical models proposed. Then they using their novel technique with neuroimaging to identify the correlation between learning and interoception. In this section, I will introduce about the experimental design briefly. First, they divide the participant into two groups, low and moderate. The low and moderate meaning is the low group is not uh, fully sensitivity at anxiety state, but the moderate is literally they are feel moderate at the anxiety. Second, there is a questionnaire results. These results remain to show the differences between the two groups in psychiatric tests. Third is the filtered detection task. This is remain to investigate multiple levels of breathing-related interoceptive processing. Until this task, they show the similar results with the previous papers, but fourth, the in breathing learning task, that task is the novel task of this paper. This task is trial by trial interoceptive learning and related brain activity, which is measured by fMRI data. After that, they use multimodal analysis to compare their measures both within or across task modalities. The first set of questions asks about the affective symptoms, and here we see significant difference between the two groups, low and moderate group. This suggests that the moderate group were more anxious sensitivity and depression show the difference than low group. In addition, the second set of interoceptive questions asked about the interoceptive awareness to measure positively mindedness. This suggests that the moderate group was less positively minded about their interoceptive awareness. This gives us an idea of how the moderate group is subjectively different from the low group. In the next, the filter detection task experiment. At first, the first figure is meaning of the brief images of the experimental task. At first, participant took 3 breaths as a baseline, and the next section, experimenter will give the resistance or give pseudo resistance to participant. Afterward, the participant will be get the question about is there any resistance they feel. Then the participant answer to this question to report their level of confidence in that answer as a number. When the experiment is finished, then they do the analyze. The moderate group shows a significant difference in perceptual threshold and metacognition bias. That meaning they are more sensitive to feeling the stimulus and are more confident in their perception that they received the resistance. These results were previously observed in the exteroceptive domain, something like visual domain. The third is breathing learning task experiment, which this paper mentioned as a novel experiment. In this experiment, participants will get the question about asking about the participant would feel struggle to breathe along this experimental trial. And then the participant is given or not given resistance to breathing after seeing the visual stimulus. In this case, given or not given resistance means as there is some real resistance or pseudo resistance to breathing. And then after that sequence, the participant will rate about how hard they were breathing. And the trajectory of these experiment trials are recorded about the prediction and prediction error of the questionnaire in the first of trial. This allows us to show behavior or model-based group comparison values in a table like this. However, with the exception of the breathing anxiety rating, there were no significant differences between the low and moderate groups. Then, in the next time, we will measure brain activity to see if there is any differences between the groups. In the fourth experiment, activations associated with breathing-related prediction certainty and prediction errors across all participants are shown. In this result, dorsal prefrontal cortex, anterior insula, anterior cingulate cortex, and middle frontal gyrus are all demonstrated significant deactivations with overall prediction certainty. That meaning is that there are similar number of positive and negative prediction strengths bar in the upper figure. However, about the analyzing the prediction errors, there is opposite results from the previous slide. Then the anterior insula and anterior cingulate cortex, middle frontal gyrus, and the periaqueductal gray. These 4 regions demonstrated significant activation with overall prediction error values. Small number of differences due to valence were found for prediction errors, but not prediction certainty. Uh, it This is with the negative prediction errors associated with the deactivations of left dorsolateral prefrontal cortex and activation of left posterior insula. Also, there is no main effect of anxiety group was observed. An interaction effect was found using the region of interest analysis between valence and groups for prediction in the bilateral anterior insula. After they get these data sets, then they analyze through the multimodal correlation matrix. The measure of the different modalities are pulled and analyzed to show us the relationship between the modalities across the tests. Here, the highest cross-task value was found between the affective and interoceptive questions, which was the first and second result. Then, we see a low relationship between the first question and the filter detection tasks. And also there is a weak relationship between the second question and the filter detection task. Finally, the relationship between the metacognitive performance and the anterior insula on the filter detection task was highly correlated with negative prediction error. Then they also do the another analyzing tools, which is the principal component analysis. To assess the extent of shared variance across interoceptive measures, the multimodal data matrix was then subjected to a principal component analysis. This analysis allowed to delineate how many underlying dimensions may exist within the data. Then after that, they found the two significant principal component axis through that analysis, and then they compared between the groups. The first axis showed the significant differences between the groups with a high coefficient and on affective measures such as depression scores and state anxiety. On the other hand, the second axis did not show a significant difference between the groups, showing a high correlation in the anterior insula. And then the result is over. Then they mentioned about the purpose of this paper. The significance of this study is that they not only established their own novel task, but also they conducted a meaningful analysis by connecting interoceptive things with brain activity, which has not done in the previous experiments. This suggests that anterior insula represents interoceptive prediction differently depending on the level of anxiety. Thank you for listening. If you have any questions about this paper, please contact me or professor. Thank you.